Good afternoon, good evening. Welcome to the third episode of Accelerate Bio podcast, hosted by Data Lake and jointly with BiohackerDAO. Hey, Em. And today we have our guests here from Mudo Hub. We're gonna tell you in a second what's Mudo about. So let's do a short round of introductions. So we have Sam, the COO of Mudo, and we have Nathan, the CEO. So Sam, shall I take the stage?
Yeah, I mean, my focus has changed over the last couple of months. I'm now 100% just focused on the Web3 side of the business. So that's what I've been focused on, doing partnerships, commercial stuff, building the community and getting everyone ready for our launch next week.
Perfect, amazing news. Nathan?
Yeah, I'm Nathan Berkley, and I'm one of the founders of Mudo. And Mudo is the kind of the science arm. So we look at DNA and epigenetics, born in 2017, and Mudo Hub is our Web3 part and the consumer-facing part. So really excited to be on your channel today and talk about where we're heading in the future with Mudo Hub.
Thanks for joining us, guys. So I think we should take a brief 5 minutes at the start to review on what has been going on in DeSci during the last week. Do you have some news for us, Em?
I just unmuted myself. I feel like there's so much going on. Like we're entering a new wave of hype somehow, and it's crypto, so a lot of that hype is meme focused. There are like all sorts of legit and semi-legit DeSci projects launching meme coins that I'm seeing on Ethereum and Solana, and they're going up a lot very quickly. But I guess question mark how sustainable those projects are gonna be in the long run, without naming anyone. But I think it's a good sign for the space. It makes me bullish that DeSci is on the radar, even for people who haven't really been in the space before, even for like the crypto common degens. And I think it's gonna be super bullish for projects like ours, which are not just meme coins, if you can believe it, but actually delivering some real value. So feeling pretty good about that.
Can I just add that, because it's so funny what you say, because someone launched a meme coin and used our ticker, right? And this is a couple of weeks ago, and it went up. Like when I found out about it, it was on Solana, and it was up like 4,000 or 5,000%. I think they did like 45 million. I couldn't believe it. I mean, I was just shocked. But yeah, I echo your point, Em. I mean, it's super exciting, and there's loads of cool things going on. I mean, the space when we started in the summer was really rough, and now it's the hottest thing in Web3. So super exciting.
You should probably seal them and get like 10% of their token supply for using your name.
Your sound's coming through quite muffled. Could you repeat that?
I said you should probably seal them and get like 10% of their token supply for using your name.
Do you know, it's really sad because people keep saying, "Oh, I invested in the project, DNA," and I'm like, "Where did you get it from?" And it's quite painful to tell them that it's not the real project.
Is it called DNA? Like literally DNA?
Literally,
all right.
Yeah, they killed us. We've had fake Twitter accounts made. We've had fake websites made. I mean, we've been under siege over the last couple of weeks, and yeah, it's really upsetting, to be honest, because a lot of these people, I'm not saying everyone did, some people just like the meme coin pumps, but yeah, we've had quite a lot of people coming into our community saying that they've invested, and sadly they haven't. And I did get warned about this. They said just before you launch, be prepared for loads of fakes and scams and things like that. But yeah, it's painful to see, really, but it's it's a byproduct of the space, unfortunately. And I think until things get a little bit cleaner, it's just going to keep happening. It's so easy to launch a meme coin with no KYC or AML or anything like that. Anybody can do it. So yeah, sad, but hopefully it's because we're making some good noise at the moment, and that's why people want to do that. But anyway, yeah, exciting times.
I'm hearing sort of white noise from one of you guys. Oh yeah, that was you, Sam. Definitely.
Was it?
Yeah, it was. Weird thing, but let's just go ahead. It's gone now.
I've got a proper microphone now.
Ah, all right. Since you've been doing a lot of AMAs lately, right? But I just wanted to tap into the fact with a lot of DeSci scams and tokens popping up because I've seen there's this fund on Solana itself. It's legit, right? It's this big pharma AI. They've collected like 600 million, in a market cap, and they want to flip big pharma. But there have been like several tokens that have been donated to the fund that hold tickers like ACC, so Bio Accelerate, or like a Bio Protocol. Bio Protocol doesn't have a token on Solana at the moment, so I think you guys, not the only ones, and there's a lot of people that are trying to make look-alike tokens on Solana, just to capitalize on the quick gains.
Crazy. I want to know about what you're doing. I mean, you've been, obviously, I follow you guys closely on Twitter. We're partners, and I'd love to know a bit more about what you guys are doing. I think it's super interesting approach.
Oh, you mean the latest news that we did with the Lake Fund platform, right?
Yeah, I think it's brilliant.
So we actually thought, that we already have the research platform where we provide researchers with all the needs, to recruit the patients towards their data-driven research. But there's a huge problem during the first step. So the researchers approach us and they don't actually really have the money, to finance the bounties for the patients. They have nothing to start with. And we
Right.
really want to, unlock the borders that are put in place. So, for example, imagine you're a scientist that's 19 years old from India. There's no way you can afford all the tech. There's no way you can pay the patients to be recruited into your trials. To start doing what you love. And we believe that DeSci has no borders. So we're opening up the platform in a way that anyone can approach us, to tell us about their research and make a proposal to the community. And if that passes through, we will be able to help them with the A to Z, process from raising the funds to fund the research towards using our platform, recruiting the patients, and actually conducting the research itself. So that's the
Amazing.
platform that we will be launching very soon.
Right.
But I would love to now tap more into, Mudo. You have the token DNA that's coming up. I know you're in a well-established, epigenetics laboratory in the UK. So I believe, Nathan, you're the right person to answer this. What's the story behind it, how it all started?
Yeah, sure. I'll give you an overview of where we started in the world of epigenetics, and then Sam can kind of move on to why the blockchain and why we're building this business on top of the blockchain. So yeah, we started back in 2017, and we actually started in the world of elite athletes, where we were looking at how we could improve human performance. Firstly, through DNA, so understanding the cards they were dealt and how we could best optimize them. But being athletes and the team coming from that world, if you can't measure it, how do you know you're improving it? And that was the epigenetics part. So my DNA's fixed, but the epigenetics is how my lifestyle affects those genes, how it methylates basically. So what I eat, what I drink, my environment, that then methylates those genes and either turns on good performance, turns it off, turns on good health, turns it off. And that was really important for us, that measurement piece, which is why we started doing epigenetics, and one of the few companies that do that. There are lots of DNA companies, but there aren't many then that do that next piece, which is after you give someone a recommendation, is it having an impact on their health? Is it slowing down the aging process? And what we do through the handset, why do we use the mobile phone? Because there's two things we keep with us all of our life. It's our health and it's our mobile phones. And sadly, we spend most of our time on our mobile phones and our money. So it's about how do we integrate those two things together? And we're based here at British Telecom's Research and Development Centre. So the handset was very important to us because it brings in all this other information around epigenetics. It's fine me saying, Oliver, your biological age is 2 years older than it should be. So you're aging quicker at a cellular level than your chronological age, but we need to know why, and that's why we collect your geolocation, your fitness trackers, health questionnaires, all this information to understand why your genes are reacting, which are exclusive to you, in the way they're doing. And we've won some amazing business over the years. We've got over 365 health practitioners and businesses around the globe that use our platform. And we've built over 40 applications, so apps for individuals and businesses over the last 7 years. And we're working on some really big research projects. The biggest one, I guess, is Predictum with the EU around Alzheimer's, where our platform is being used for that. We're working with Singapore University around some really interesting research over there. And then Exeter and Stavanger University about some really interesting information around how our genes and the aging process. So we have that front end piece, which is for everyday use, helping people prevent something coming. We have the middle piece, which is the clinicians that use the platform to report back to patients. And the very exciting piece at the back end is our bioinformatics platform, where all of this data sits. And that's a really good segue, I think, into Sam talking about where all that data sits in Web3. I can't hear.
We cannot hear you, Sam.
Can you hear me now? But you buy a nice microphone and it doesn't work. Yeah, look, you know, coming into Web3 for us, it was all about building trust with the consumer. You know, it's not a super complicated product. We've got real world use cases for blockchain. You know, we want our customers to have trust and confidence with us because we're a healthcare brand first and foremost, and we're giving them transparency as what's going on inside their body, and we want to kind of have that same principle with the products that we sell. So we're going to be using all of that research that's been done over the last 8 years, and we've designed a series of products that we're going to be launching over the next 12 to 18 months that are backed by 8 years of science. And manufacturing those products ourselves, great use case for blockchain technology is obviously supply chain provenance, which is why we partnered with VeChain, who I'm sure you guys know VeChain, super established in that space, work with tons of blue chip companies. So they've got a plug and play platform, which is super easy for us to just input the data and get that on chain. So people will be able to see what's in it, where it's come from, who's made it. And obviously we can add in some educational pieces as to why we've put those formulations in. I think as a healthcare product, I would love that myself personally. And I think that the market is moving towards more transparency. I think people are moving away from big pharma. You guys know it, you guys are in the space. So it's a really exciting time to do that. Secondly, as Nathan mentioned, data is a big thing, especially in Web3. It's probably one of the main buzzwords that you hear in Web3, but not many projects I've seen have actually used data to create any value. For us, we're using that data to personalize products, to give you products that are designed for you based on your epigenetics, and then using our platform, you're able to track and measure the effects of those products as you go on this journey with Mudo. So that data is really valuable, and how do we reward people and incentivize people and give confidence to people that that data is safe and secure? And again, I think the blockchain is the best technology in the market to be able to deliver that platform. And then thirdly, you know, using tokenomics and using, you know, crypto incentives is a really cool way to build a brand or a community and incentivize them in a way that you're never going to get BlackRock to write a check to let you do these kind of things, right? So, you know, again, it's disruptive, it's the future. We believe everything's going to be on blockchain in the future. So just trying to catch up with you guys. You know, you were one of the first projects that we were following when we started looking at Web3. So we're super happy to be partnering with you guys and working with you guys, because, you know, to what you said, Em, I think there's so much, you know, fluff in this space, you know, projects that, you know, really shouldn't be called projects, but let's not go into that. So as of today, we are launching our first Web3 app on our chain in January. It's a hyper personalized all-in-one wellness platform with an AI assistant that doesn't give you the results. It helps you to understand those results. It tracks your progress. It allows you to set goals and keep you on track to achieve those goals. And then furthermore, when you do repeat testing, you're able to you're always adding that information to the AI health coach, which is learning about you, learning from you. And, you know, the more times you do a test, like with a DNA test, you only ever have to do it once, but with epigenetics, it's always changing. So if you go on a lifestyle change and you track those changes over time, that information to researchers is super, super valuable. And yeah, I think that's going to be a really, really good benefit to the person and to the DeSci community, being able to, you know, measure the effects of these protocols and products that we're doing. We're launching our supplements in January as well. So our beta goes live on the app, and we're doing the first batch of supplements exclusively for our community, whilst we get the branding right and the packaging right. So it won't be the final product during the beta phase, but we've also got 6 consumer applications with real world products to build an ecosystem. So, you know, I always say it in the AMAs, we're not building a traditional blockchain business. We're building a business on the blockchain. And sometimes I think people find that hard to understand. I actually got attacked on an AMA the other day, like really aggressively, because apparently we're just a supplement company trying to call ourselves DeSci, which I found quite funny. It ended up being quite an argument. But yeah, look, the future is Web3. And, you know, whilst we have got all of our own kind of we've kind of vertically integrated in the Web 2 side of things. We really want to be a part of this DeSci movement, and I think with the research platform that we've got, with the epigenetics testing that we've got, the partnerships that we've got, we can add a lot of value, but we're trying to partner with quality, not quantity. And I know I was meant to get you that test out when we spoke last time, but we've actually had, when we did our pre-sale, we had over 2,500 people now of individual wallets have done it, and we're sending out about 1,200 tests. Half of them have come and actually requested getting a test, so we're doing a big batch just before Christmas, so you will get that. And love what you guys are doing over at BiohackerDAO. I think it's a really cool project, and Oliver has been a great supporter of ours since the beginning. So yeah, we're trying to be disruptive. Blockchain's about cutting out the middlemen. Everything that we do, we're manufacturing ourselves, and that's how we can really offer so much value back to our partners, our DAO members, our communities, because we are not being greedy. We have a less is more approach. We want to make this technology available to everyone, so you don't need to spend $3 million a year. And actually, with tools like what we're all building together, we could really make premium personalized healthcare affordable to everyone. I think that for me is a noble cause, and super excited to be doing this. And I think the blockchain's a no-brainer for us. So it's kind of an intro to what we're doing, and ask any questions if you want. But if you let me talk, I'll keep going for another 2 hours. So I'll let someone else say something.
I think that's a really good intro, actually. There is so much to unpack there already. And yes, by the way, I'm waiting for my test. So.
Yeah, it's coming. Don't worry. I know I promised it, but we're sending them all out in one because we ran out of the new packaging. So so yeah, we're sending a new batch out.
So it was good. But one thing that I really want to pick up on there is, so you mentioned being an epigenetic testing company and more, and then the blockchain side of the business. And so in my experience, and I think it's the same for Oliver and Data Lake, there are basically two, usually fairly distinct audiences. So one of them is very, very crypto native. They understand the blockchain. They are very bought in the vision of decentralization and everything we're doing there. But a lot of them don't really know that much about personalized health, or don't need to be educated basically to care about the space. And then there is the other cohort which cares really, really deeply about personalized health or biohacking or whatever we're doing. But that average person is usually not very crypto native and doesn't really understand what's the value proposition there. So has it been like this in your experience? And what are you doing to bridge those two cohorts, and what kind of education is needed? How does it come together?
Do you know what? It's a great question, because we've had probably hundreds of people that have invested in our project as the first time that they've ever done a crypto project. We keep getting that in the group, and I always ask why, because I do VCs in the Telegram group pretty much every day, and I always ask the newbies why did they choose this project, and they said because I actually understand the benefit that I would get from the product, and I can see the benefit that other people and the potential that it has. So wanted to get involved in crypto, but never really found something that I understood. So that was really nice. But what we're actually doing is not targeting. We never set out to convert web.
Is a little weird.
Oh, is it? Is that better? Is that better? Is that better?
Yeah.
Set out to convert. Can you hear me? Yeah. We never set out to convert Web3 users into customers. For us, it was about the technology and making our platform more efficient and more effective. But we've actually found quite a lot of these Web3 guys are interested in it. But the way that the applications will be built will be very much Web2. You won't really even know that you're using a Web3 application, because all of the technology and the benefits are in the back end. And we've done a couple of partnerships, one with Zbeck, who do the Apple Pay, Google Pay debit cards. So to the normies, we're trying to sell it to them as rewards, Tesco rewards. I don't know what other Club card rewards kind of point system, Marriott points. So that's very well established. Lots of apps and applications do reward points. So, from the look and feel, there's nothing scary. The wallet is in automatic, Google sign up, nothing complicated there. You've got a debit card and you can pay with the Apple Pay and the Google Pay. So that's very established technology in Web 2 to normal people. Also, we've done a partnership with Flues, who built these really cool Telegram apps. You should definitely look at them. They're awesome way. They've got some really great community engagement pieces, but they've made it super simple that you can just go into the Telegram app and just buy it there. You don't need to you don't need to go to an exchange. You don't need to open up a wallet. So really the kind of things that we're trying to do is to kind of bring in utilities or technologies that make it super easy, that it's just click button buy. But you're right. I mean, there will definitely be different target audiences. I think if any normal Web 2 consumer came into our Telegram group, they'd probably run away, shocked at what they see, because it's like a mad bunch of lunatics in there, myself included. So I'm not insulting the community, but so you have to create the different audiences, and that's really why we've created, rather than trying to build one platform for everyone, we've focused on different niches. So we have the mother care platform that we're building, we have a healthcare platform for gamers, we have a coaching app for martial artists, we have a coaching app for football, I'm forgetting some of them, the wellness platform. We've just done a partnership with Avro, with the biggest supplier of physical medical testing devices in Europe, and we're going to be, don't know if I'm dropping too much alpha here, but we've got some pretty cool hardware that will be coming out as well. So we're creating applications with different target markets, and obviously, the way that those communities will be managed will be completely different. But, to answer your question, it's all about keeping it as neutral as possible and not scaring people with words like crypto. And Nathan, did you?
Yeah, I just add to that. So look, we're GDPR and HIPAA compliant as a business. We have to be in that application. So it's important that blockchain is used for that consent and security piece. Your data will never sit in the blockchain. There are some really interesting technologies coming in the future, and that may happen once we know it's secure. But it's about giving the end consumer the control. So, for instance, you would be pinged in your rewards to say, would you like to take part in this trial for cancer research? And that's there when we would probably engage with Data Lake. Or it might be on the flip side, where it's something that isn't as medical, around fibromyalgia, where we have lots of people in that community who go, look, there's 2,000 of you, there's some really interesting research that we've seen in our bioinformatics platform. Would you be interested in sharing that data anonymized with lots of people that are suffering from the same thing? So not waiting for that medical white paper, but actually sharing some of the science, the interaction they've had, and things that have worked for them to alleviate the pain, to help them. So it will work two ways. For that end consumer, it's about being as seamless as possible. They won't know that they're in Web 3 and they won't know they're in Web 2. It's about the application dealing with them as they want to see their data and how they want to interact with, whether they're really techie and understand the blockchain, or actually they just want to know, what do I need to take to get better? So it's about dealing with each customer as they come into the application in a way they want to be spoken to.
I think that's really great. You guys tapped into how you're planning to bridge the gap between the Web 2 and Web 3, and how you actually pay attention into not scaring people, because there's a lot of projects that they come with all the crypto stuff, and there are people that do not understand the crypto stuff, and you should have an option at the end of the day, that if you don't want to do everything related to tokens and having your own wallet, you shouldn't be forced to do so. It should, it should be an optional thing, right? But you tapped into sharing data, and I'm a big data freak. I myself have a major in big data and AI, actually. So I'm just wondering, since you have a huge user base, and you're gonna have potentially researchers interested in your data. How do you actually plan to handle this DNA and epigenetic data, which is deeply personal? How you want to ensure the data privacy and compliance? Imagine someone has already a bunch of data stored on your platform, and you want to put the data into research. He agrees, right?
Yeah, I think it's a really good question, Oliver, and I started speaking about it a lot. I was at King's College at Longevity Week the other week talking about this. I'm going to Arab Health in January, and my whole talk there is about your data and data security. No more is the Middle East, is your data protected heavily, with big repercussions if you don't store it correctly. So for us as a business, your data sits across 4 platforms. even though when you do one of our diagnostic tests, that's the difference, I think, between us and a lot of businesses. We're not saying we're a strange platform, upload your data. We actually get your data because you've done a diagnostic test with us. At that point, you give us the consent to use your data. We still believe ethically that even though you've given that consent, if ever we are asked to do research and your data is to be used, we would ask you again. So we would send you a message to say, Oliver, it's a fibromyalgia study, or it's an Alzheimer's study. Would you like to take part? Your data is anonymized. It's never seen as an individual. They know nothing about you. As a collective in our bioinformatics platform, they are allowed to ask it questions through our system. So the data never leaves us. It never goes to it never goes to somebody else's data. That healthcare provider cannot download your data. And that's where then if we're getting into the world of the medical data, which we're all about prevention, that's what we do. We would then be engaging someone like yourselves around that consent piece if we want to have that extra layer of data overlaid. And then our partner Avro that collect glucose monitoring data, heart data, we would then overlay them if the end researcher wants that information as well. And at each step of the way, we're ensuring that the end user gives their consent, or that data can never be interrogated, because ultimately it's their data. That's the beauty of what we're doing in the Web3 world. It's about giving the power back to the people. Your data, your choice.
That's very well said, you know. And I love when projects actually approach it in a way, you know, that you can run your federated learning, you know, inside of your databases. You have a knowledge graph that you can ask questions, but you don't actually reveal, you know, your whole data sets, you know. And that's the magic basically of, you know, what we can do in the whole DeSci, decentralized data and decentralized storage world, right? We can decentralize stuff without actually compromising on the privacy.
So I would love to step back from the blockchain and from the tech side of things for a second and just dive a little bit more into the epigenetic side of things. So I'm not sure how familiar with this technology most of our listeners are. I guess some will be, and maybe because Brian Johnson has done a lot to popularize this, quantify everything, and also epigenetic testing, measure your biological age or your chronological age, and whatnot. But maybe just to give an overview to our listeners. So first of all, like what the heck is this technology about? What can it do today? What can I learn from my epigenetic profile? And also, I would love to like pick your brain on how do you extrapolate in the future from here and maybe like 5 years from now, like how much more advanced is this technology gonna be and what can we look forward to?
Yeah, I mean, it's a great question. I mean, when we kind of used the word epigenetics in the early days, most people couldn't spell it and no one knew what it was. It's become very popular. Longevity world, the world's epigenetics is a buzzword, even though a lot of people don't do epigenetics. So epigenetics is how our environment, how we live our lifestyle affects the genes that we were born with. So our DNA is fixed. You don't need to redo a DNA test, although gene editing is coming rapidly, and some countries are already doing it. But the reason our DNA is different is everybody on this call looks different. That's based on our DNA. What that means is internally, we all process everything very different at a cellular level. So the food that we eat, how we absorb the sun, depending on our heritage and our background, how we are affected by stress. That's all controlled by our genes and our genetics. If you imagine your DNA is a valve, and everything you pour into that on a daily basis, so what you eat, whether you're stressed, whether you're happy, whether you're sad, that then expresses itself either in a positive way or a negative way. So it's why I might feel sad, it's why I might feel happy. It's about pouring those things into our genes to express them. And what we look at is how do we make sure that we can kind of make us as happy and as live as long as possible. Although I don't like the word live long, we're more about why in my 70s can't I be as healthy and as active as I was in my 50s. So for us, it's more about livability, enjoying the time I have here and making sure that I'm feeding my body all the things that it needs to either see my kids grow up, enjoy life. And that's the epigenetics part. That's the measurement part, which means that you can do testing regularly over time. So most people either do it twice or quarterly. Some athletes that we work with do it a lot more because they're looking to see how things affect their body. But that's seeing how I live my lifestyle in a non-clinical environment, because none of us on this call are in a clinical environment, right? You know, Sam's in Dubai, Oliver, you're where you are, you're in Malaysia. So we're all in a different environment. So nobody lives in that clinical environment. So it's really important that we can look at what's affecting you as an individual, and then giving you recommendations that affect you as an individual. And where the future is, I mean, we're working on onset clocks. So it's really important that when we look at the aging process and how we age, we published a paper around methyl pace, which is one of our clocks to do with cognitive function. But we're looking at all the different areas that we can to give you a kind of age of pacing. How do I push that out, or how do I improve that aging process? So almost gamifying how I live my life. That's where we're going to be going later on in 2025. And I think epigenetics is really exciting. We're already looking about, you know, part of the raise that we're doing around Web3 is bringing in our own machinery and having it designed where actually we could design supplements that are hyper personalized. So currently we'll be launching in January where they're personalized around your DNA. So these are the nutrients that at a subcellular level that you may have issues processing or you need to take. So they're personalized to you. But in the future, we want to be able to hyper person. So understanding your environment, understanding your goals. And why not in the future? Even around your health records, they could be personalized to your health records or supplements. So when you come out of hospital, if your immune system's low or whatever's happening to you, wouldn't it be great if in a few years' time we could produce vitamins and supplements that will give that body the boost to improve it and make sure you have the speediest and quickest recovery? So I think epigenetics is going to grow rapidly. It's a big topic of debate, especially now with the Trump administration and Bobby Kennedy. They're all about prevention. And I think epigenetics is really in the headlights now. So I think it's going to become less alien to people, and they're going to understand it more and more. And as a business, we have a science series coming out from our team to talk about and help people understand it.
Just to add to that as well, you know, there's Nathan said earlier, there's thousands of companies that do DNA testing, and there's very few companies that do epigenetics. And there was a really interesting podcast done a couple of weeks ago. I don't know if I shared it with you, Oliver, and I won't name names because I'll get in trouble, but you can go watch it. And they looked at the 4 kind of companies that are doing epigenetic clocks. And well, I mean, some of these guys have had over 100 million in funding, and they sent 2 tests back at the exact same time under different names. One of the biggest, probably our biggest competitor, there was a 10-year difference in the samples, which was pretty shocking. The next one was 2.5 years. I think the next one was 2, and ours only had a variance of 0.4. And when an independent study was done by Manchester University at the time, they looked at 754 genetic testing platforms. We came 1st, 2nd, 4th, and 7th because we do white label platforms as well. So, you know, Nathan was being always much more humble than me when we talk about these things, but, you know, I sell the dream, they make it come true. So naturally, that's my job to give a bit more sizzle. But in terms of epigenetic clocks and you know, Nathan, you didn't really expand on the question where, you know, what clocks do we look at? What do we actually look at? And what are the benefits that we offer to people? You know, I think it'd be great for people to hear, you know, some of the stuff that we've got in the app today and some of the stuff that's coming later with the onset clocks, because that's super exciting.
We look at those key metrics at the moment around aging and the onset clock. So it's memory. So cognitive decline is really important. That's why we're involved in the Alzheimer's study. It's a big passion of mine because I lost my father to Alzheimer's, which is one of the reasons I got into genetics. So there's onset clock around there. How do we slow down that cognitive decline? Because for me and my children and my family, that's one of the most important areas because we all have inherited those genetics. And I think the second part of that, we're looking at inflammation. Why is inflammation important? For athletes, obviously they're inflamed quite a lot. People think they're really healthy, but if you're constantly inflamed, it's good in small doses. But if you're constantly inflamed, it really pushes your biological aging in the wrong direction. And then we're looking at things like eyesight and hearing, all the things to do with aging. And then in the future, we have some coming around kind of heart health. And also around muscle and muscle degeneration as we get older is a really important area. So how do I improve that and make sure that I can live my best life and not be a drain on my family, but enjoy the time that I have here. And I think that's really important. And it's not about scaring people. So we're not looking at the onset of disease. We're looking at those age-related areas. How do we push them out as far as possible based around our genetic makeup, which is the reason that we're all different.
And just to add to that, because there's such a big buzzword about AI at the moment, it's so everyone's talking AI. You know,
You know,
every
Sam, I was about to ask you a question about AI, but go
go
ahead. I
on.
think you're gonna. No, 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 no.
No,
Go ahead.
no. Yeah, okay. No, but it's just, you know, it's a big buzzword. And, you know, you could ask ChatGPT for a workout routine every day and it will give you a different answer. So, you know, just to clarify, every recommendation in the application that we give out, it's not being generated by AI. We use AI in our bioinformatics and the algorithms, but every recommendation that we put inside the application will come with 5 peer-reviewed white papers. And that's how the current platform is set up. So, no snake oil salesman stuff. Everything is backed by validated science, and the AI is really to enhance the experience. Because I think when I did the test, you know, I've got really bad ADHD. Like, I mean, if my attention goes, I'm gone. And I found it really difficult to go through the app and actually read it, because we provide all this information, then the white papers, then all this, and you can get really lost. So I think, you know, why we've put AI into the application is just to enhance the experience, so that you can ask the AI. You don't need to go to Dr. Google. You can ask the AI, okay, this is my results. What does it mean? And then how do I improve it? And then have that tracking and progress tracking, so that you know that okay, I've looked at my eye health, I've looked at my brain age, I've looked at that, and you can go through the application at your pace. You know, when I introduce the app, I call it a hyper personalized all-in-one app. It's really for you. You tell what on the onboarding, like with Netflix, you pick a couple of movies that you like, and the algorithms will then pretty much know what you like, right? So on the onboarding process, you know, we want people to set their goals. If you're, you know, into meditation and breath work, for example, you know, that might be what you want to do for your mindfulness and cognitive games, if that's something that you're interested in. But you can clutter it or declutter it, and the AI is really just there as an assistant, stacking that information for you and being able to remind you. And actually the things that you don't notice is really like, wow, when you go back to it, it's like, oh, I didn't realize those correlations. So it enhances the experience for the customer, it enhances the value in the data, because it's always tracking, measuring and optimizing. But also, as you go on that journey and the more tests that you do, actually that could one day be life-saving information. Like, you never know, if you're going to a doctor, something happens, and you can look at the last 3 years of your lifestyle to find out what was the reason that you got sick. And, you know, with the mother care platform, we're tracking the epigenetics of a pregnant woman through each trimester, doing personalized nutrition each trimester. But then when the baby's born, that mother is going to be empowered to track the cellular development of her child from birth. And that's never been done before. So that kind of research, you know, is unheard of at the moment, and we're really excited about those kind of things. But to not scare people, because I think AI is misunderstood, can be quite scary, and I actually think most people don't really understand AI when the way that they talk about it makes no sense. But for us, it's to enhance the experience, it's to keep you organized and just make it much more fun, so that you don't have to click all these tabs. Because I got lost. I mean, I said to Nathan, I said, how do people use this? I was like,
I think
I can't do it.
the best way to describe it is, you know, AI, everyone's expecting this, wow, it knows everything on day one, but you've got to imagine it's like a baby, and it's your baby, and the more information you are prepared to give it, the more it understands you, the more it grows, and it will give that information back. What we don't want to be doing is using AI where it's going out, bringing this other data in that's nothing to do with you, or sharing your data anywhere else. It's really important that that AI is locked down. And it's purely looking at your data around our system. It's not sharing then that information with anyone else. I mean, there's some really interesting legislation coming in around AI and health data. And we've been making sure that we're going to be compliant to that. It's really important that we're not allowing AI to take your data and put it out there in the Ethernet. Unless you want to go and do that and upload it to someone, that's your decision. But us as a business, it's about you. It stays within the system, and it never gets shared anywhere else. It's not to say that we might have a secondary health coach that's pulling some of that general information out, but we would never let that data to leave the system and you lose control of it, because there's nothing more personal than health data.
Absolutely, that's something I wanted to ask. You know, how you actually guys use the AI, and I think you perfectly actually described all the points, you know, and all the concerns that people actually might have. I'm just wondering, you know, I'm really interested in the side of things with the personalized supplements, you know. So I know it might be a little bit sci-fi. You know, it's something you're planning, guys, in the future. But I did a test with you guys. I sent it to you already. I'm waiting for the results. You know, and imagine, you know, something is little bit off. So how would the whole process look like? Like, who do you compare me with? You know, what do you recommend me? Like,
Yeah.
how would the flow be for me? You know, since
There's,
I, yeah,
there's
go ahead, Nathan.
there's two parts to the answer to that question. So the first part is we have a base formula. That base formulas are based around our whole data set. So these are the things that we know that the body needs to start. So we need VIT-D and K2 to, they're the spark plugs for our genes. Everybody needs to be taking that. But there's about 50 ingredients in that base supplement that's giving you the spark plug for your body to start first thing in the morning. And it's also got ingredients in it that we can prove out and show you through the research we've done over the last 7 years has an effect on the aging process. So it's either slowed down cognitive decline, helps with heart health. So you get that base formula. Once you do your test, you will then see areas that you are deficient. So maybe something's in my blood, but that's subcellular, but actually can I convert that at a cellular level? Then you get top-ups individualized to you that you need to take just for you on top of that base supplement. And then where we hope to be by the end of 2025 is it's hyper personalized to you. So it's changing all the time around your epigenetics. So it's really exciting for us. That first bit means it's personalized to you and your genetics. So if there were 4 of you in the family, you probably wouldn't be taking the same things, even though you're sharing a genetic makeup. There will be different areas that you would need. So it's about delivering something to you, firstly based around science, and secondly based around your DNA, which is personalized. There are lots of companies out there that claim to do DNA testing and personalize your supplements, but when you ask the question, that bag's the same for everybody. And I get that with a base formula because there are certain things that we all need that we've proved out, and that will be in the blockchain from seed to source and provenance, which is what Sam mentioned, to show you where every ingredient came from and why it's in that supplement for you. And then the secondary bit is once you've done your test, DNA to start with is the personalized bit. And in the future, in 2025, it will be hyper personalized.
So that means that if I do another test, you know, I take the supplements, you know, some of the markers there might change, you know, and I might need
Correct.
to adapt, right?
Yeah,
And
as your biological is moving, we'll be able to work out where you're going. I mean, we're doing a really interesting research, and while they've just confirmed it with a big company in Asia, so we're going to be doing a big piece of research as well around, which is a great one for Data Lake to be involved in as well, which is going to be around patient data. So how do we personalize it to patient data? And they're really keen to work with us on that to go, you know, you've got my medical records, you've got my genetic records. How do you really put something together here that's going to make me recover quicker, be healthier, or more importantly, not have to go back and have that clinical intervention potentially in the future? How do we work together with, because we are about prevention, we're never gonna do drug discovery. It's not to say we won't work with research partners that want to do that, but we're about prevention. So this is where we then maybe partner with other people within that world around research to see, you know, where can we mirror each other. You know, sadly, you know, sometimes you do need that curative approach, but how do we either push that out or potentially stop that happening again? That's really exciting for us as a business, and ethically we believe that, you know, prevention is the future.
I would love to ask you my favorite sci-fi question now, which is if I gave you $1 billion tomorrow, which kind of scientific research would it fund and accelerate? And it can be something that will make your product 10x better. It can be completely unrelated, up to you.
I think it's a really good question. And the big problem you have with healthcare is it's expensive, right? So, you know, it's not cheap, and it's timing, right? But epigenetics takes a long time. You know, in the future, we've already started to blueprint out a machine that can sit in every single cafe, gym, even at home. So you could biohack on the fly whenever you want. Imagine you could test instantly with your mobile phone and check your epigenetics on a daily. You could go to the gym, check it pre and post. That's a really exciting piece of technology that I don't know how long it's going to take us to get that to a point where it's testable, but that's where we're working. And our science team, if they were on the call, some of them, you know, X-Men's a reality, right? There are certain things you can do through gene editing. You know, I think ethics is the key part here, and the biggest worry for us as a business. Let's work out maybe through that machine how we can make it accessible to everybody, and then secondly, you know, let's look at how the ethical part around what we do. Make sure we make the right decisions about genetics. You know, we don't want to play God. That's not what we should be doing. It should be about, how can I just make this individual healthier and happier and help them rather than potentially making decisions in life that are unethical.
I'm actually very curious about your take on that. So, do you think once we have like advanced genetic modification technology available, should we be just using it to make unhealthy people healthy, or should we be using it to make healthy people enhanced or like superhuman, or like go a few steps further than
Yeah,
we are at
I mean,
the
it's a
moment?
great question, right? For me, having had people in my family ill, I don't like seeing people ill. I think, making everyone live forever is going to be a real problem. The planet won't survive. I think that's a natural process, right? Where we live, we know how long we're here for. Let's enjoy it, okay? And let's be as happy as ever. If we're all going to age, I think society's going to have real problems. Maintaining the food chain, the planet, everything else. So, for me, it's not about being immortal. I think it's while we're here, if we can stop a lot of these horrendous things happening to people so you don't see your loved ones suffering, or actually we don't become a burden for our loved ones. When I looked after my father, it was, for the last 2 years when he had dementia and Alzheimer's, it was shocking. This guy I kind of looked up to, suddenly it's almost like role reversal, isn't it? As we get older, we then start being cared for by our younger ones. And I certainly don't want to be a burden for my family in the future. So I think for me, it's about trying to be as active and as healthy as possible. And that's a dangerous word, active and healthy, right? So some people see active as someone in Lycra or a guy with a six-pack and big muscles in the gym. That's scary for a lot of people, right? The gym isn't the friendliest place sometimes for you to start that. Being healthy for some people is going for a walk. It's mindfulness. It's different things. So I think it's important that we focus on all of those areas and try and personalize something so it's a passion point. How do we make people more healthy? Find their passion point and focus on that. What's your passion point to be healthy? Is it big muscles? Is it to not be a burden on your family? Is it to go for a walk with a dog every day? If we can use epigenetics and genetics in the future to help people do that, I think society will be a better place for it.
Just to add to that, but making sick people more healthy, but the part of it that worries me is like the potential of choosing your child's eyes before they're born, and how smart is my kid going to be, and all of a sudden we're just going to have like a human race of super intelligent, emotionless, kind of almost humanoid robots kind of thing, and these kind of things get abused. And to echo Nathan's point, we're not about playing God and doing things like that. We just want to help people enjoy their lives and feel better, but also be able to understand themselves more, and be their own doctors. Because at the end of the day, most medical interventions could be avoided with early detection and lifestyle changes. Everything starts based on what you put in your body, your environment, stress. You could eat all the right foods and do all the right exercise, but if you're constantly stressed, constantly worried and things like that, it's going to have a negative effect inside of your body as well. So for us, it's about that mind, body, soul connection, and trying to give people a platform through the comfort of their phone where they can get all of that. And there's some pretty scary stuff that we've been looking at and reading about, and it's super sci-fi. And I'm not really, I like to watch happy family movies than scary, sci-fi movies. But each to their own. Let everyone do what they want to do. We're not trying to take over the world. Our business is super profitable with a relatively small amount of people. But I think that the potential of what we've got here, and with the different applications we've got, we could touch a lot of people, and we're really excited to do that, basically.
I think all being here, right, we're all in the world of blockchain. We've got a DAO. I think letting the community take control of some of this, so you're putting it to the vote on some of the things, is really important, right? That's where I think a lot of the ethics will come from, to stop maybe people going down this pathway with your data. You're like, ooh, hang on, I don't agree with that. So at least you're getting the voice of public opinion. And I know you can't necessarily run a business by committee, but I think there are some important areas where a DAO can play a really interesting part, where people around their data can go, okay, where's this going, and where's the reward, where's the research? It's kind of putting the power in the hands of the people rather than a few is the long-term aim, right?
I think that's one of the most interesting parts of being a crypto-based project, or like dropping a token and having community involved in some of this decision making, is that, as you said, you probably don't want the community to run the whole show, and you're still in the best position to understand how you should develop your product. But it does give you some really unique opportunities to get communities feedback and input in a more effective way than you would have with a traditional.
Yeah, definitely. Sam just put an education video out there for from our lead data scientists to go, hey guys, does this make sense? Is this how you want to explain? So you're constantly getting that feedback to make sure that you're delivering the product that everybody wants. Yes, like you said, there's that business part that has to be there to maintain it, but there are certain things you can put into the community to get their opinion, to be informed, and also get some answers before you go too far down the line. And especially in science, as you guys know, some research projects can take 6 to 10 years. Imagine you've gone down this route and then at the end of it you find out that nobody wants it. So actually, by engaging the community really early is really exciting to go. Are we heading in the right direction for people who really want to know this and understand it?
All right, guys. So I want one question, because we spoke, about getting people from Web 2 to Web 3, about people, becoming healthy from being unhealthy or becoming superhumans, But if you look at the world, if you look at the economics, this only affects a really, really small percentage of people. So,
Right.
like, what are the biggest challenges in actually, having people adopt these DNA and epigenetics based health solutions, and how are you addressing the barriers, such as the fact that not everyone can right now, afford to get a test and get these, AI insights and what to do with their health, but they want to be healthy, right?
So our whole mission is to make this affordable for the 99%. At the moment, a test, an epigenetics test, can cost anywhere from £250 to some companies are selling DNA tests for $1,300 that are just DNA tests. So, for when Nathan and the guys started the business, they started on a B2B model, so they never really had to go out and find those customers themselves. But we've been able to learn all the pain points and all the friction and the resistance that you've got. And price, I think, is probably one of the biggest. People don't wake up in the morning and say, I'm going to spend £250 on a test that I've got to wait 6 weeks for to get a result. People want a now. So building the consumer business model, which is why we went into Web3, it was about removing those pain points. And part of the raise that we're doing is to actually buy our own Illumina machine so that we can run those samples ourselves, and that will then allow us to get that turnaround time down to 72 hours from the point of which it's received versus 6 weeks. But also it allows us to reduce the overhead of the cost of testing. And the aim with what we're doing, because we're manufacturing our own supplements, which is traditionally a 500, 600, 700, 800% markup from what you actually cost of production to do that. So we're balancing it out really to where we build all the value into one proposition where we want to give the tests away for free. So if you subscribe to our supplements, you'll get a free test so that you can find out what you need and then track and measure that as you go on that journey. And the cost of the supplements, just by not being greedy, because we have this token ecosystem as well, actually we know that if we can create value for the token, we've got never-ending funding, so we don't have to really squeeze every last drop of the lemon over here. So on the Web 2 side, it's about value, creating as much value for the consumer as possible, knowing that eventually the profits will come, but then using this Web 3 ecosystem that we've got to create products and services to sell into Web 2. We then do the DAO receives 30% of all products that are sold, or every piece of revenue in the ecosystem, bring that back to reward the Web3 participants, create more products and services. So it's like a dual-sided flywheel. But by doing it in this way and not having the Black Rocks and the guys that, are profit, and building this brand with the community, we've created a mission. It's not just a product, this is a movement, this is the way we see it. And by everybody agreeing to these metrics, we can reduce the price of supplements. We don't need to be greedy. Why do you need to make 700% when you can make 100% and share a ton of value back? So
Sam, you have the noise. Oh, yeah.
I think
This
as
is a
well,
good mic.
to Sam.
Wait, let me finish, Nathan. I've forgotten now what I was going to say. Oh, that was it. The cost of our nutrition, we're trying to get this down to the price where you can get all the nutrients that your body needs for less than a cup of coffee every day. Everybody spends $3-4 a day in Starbucks or Costa or buys a cup of coffee. that should really be that's kind of the sweet spot that we believe that we can get it to. And I think ultimately we've taken a less is more approach. We understand how businesses work, and really it's about building customers and building revenue, because we're only talking about two products here, the test and the supplements. Once you have that customer and they buy into your brand, we've got all of these different products that we'll be bringing out, and we've also got partners that have products. So we also want to use this platform to create a consumer base, so that when the DeSci communities or breakthroughs come out, we've actually got a platform that we can then take those products straight to market. And ultimately, once people trust a brand, it's all about building trust. Once they trust you as a brand, then you can really always sell them more products. Sorry, Nathan.
Just back to the original question. People can't afford it. How would they come in? With the Mudo Hub, they've been very clever with creating something new in the application. So you'll have free cognitive testing when you come in. So you can test play really cool games, look at cognitive decline. And the second part in that, there will be a clock that will help you look at your aging process that is for free, that's using AI and questionnaires, pulling on that big database. So at least it gives you some early indications to then educate you on maybe why I should be doing some form of diagnostic testing or taking something and look internally. So there will be some really nice elements in there that you can come in even if you haven't done a test at that point and find out some really cool information about yourself.
Also, as well, if you choose to use your data in research and those opportunities come along, obviously you're then going to look at offsetting some of that initial investment that you've made in yourself. Our big dream, the big dream, when you start a company, everyone here is a founder. What's the big dream? And the big dream is that big pharma and big data are going to end up paying for you to live a better and healthy life, whilst they're trying to research how to sell you drugs. Ultimately, they're keeping you healthy by rewarding you and purchasing your data, which eventually, could make the cost of your nutrition free. You never know. I mean, sometimes you look at Pfizer, they pay 30 grand per person for people's data from 23andMe, and that was just DNA data. So, we never try to put a value on what that data could be worth. I mean, there are metrics and proven cases where data has been used for research, but the big dream would be that we create this huge value in your data, so that when researchers, health insurance companies and things like that start looking at that data, the rewards that you receive actually will offset the cost of the investment in yourself. But I mean, you've got to run a real world business with a profit margin. Otherwise, you don't have a business. And if your business is just a chart, you don't have a business. So it's finding the balance between the real out there, the digital and the real world. And I think we've really cracked it in terms of a business model. And super excited about what's to come. I can see we've only got a couple of minutes left. So I'm going to do a shameless plug. We're going live in the next week. And it's going to be super exciting and grateful to have the opportunity to come and speak to your community, because you've got, you're one of the OGs of DeSci, you guys, and you guys have just come out as well. We shared the same wave. We surfed the same wave. Nathan, I don't know if you followed it, but BiohackerDAO was when Vitalik and CZ finally got to work to earn their team tokens and started pumping DeSci. They caught 1 million on the same day we caught 1 million. So it was it was great to watch and see and look at some of the raises that are going on. Like I've seen 5 DeSci projects launch in the last couple of weeks, or 2 months at least. And I think the Bio's launching this week or launching something I was reading on Twitter. So, the space is big now. The space is super active. All the big KOLs are talking DeSci. And, I think we need to collaborate, because that more research that we can share with each other, the more things we can prove out on the blockchain. Nathan always, he had a full head of hair before he started dealing with academia. And, we've had papers that we've wanted to publish. And, there's a £250,000 barrier to getting that published, to getting that sponsor. And that's just wrong. When you can prove something out, but you can't afford to put a logo on the piece of paper, which, let's be honest, that's all it is. It's a logo on a bit of paper. I think that's really terrible. So things going on at the research hub and all of these kind of, DeSci community coming together, I think it has the power to unlock a lot more than you would ever get going through the bureaucracy of academia and the bullshit that comes with it. So just super excited to be a part of it. And
those were some great closing thoughts. We're bang random time. So call to action, go to Mudo.com. What is the call to action?
Sorry, say again.
What is the call to action for our audience? Go to Mudo.com and
Um, well, no, I mean, just keep your eyes on the Twitter. We're going to announce it. We've got a new app coming out in January. We've got a new website being built, which is the consumer at the moment. It's more focused on the token and the DAO and what's coming on that regard. But, you know, the whole rebrand starts in January. All the new products come out in January. We just wanted to get TGE out of the way before Christmas. And, you know, we're announcing 4 or 5 partnerships this week. We've got a ton of Web 2 stuff that we're putting out there. We've got, you know, pretty much an army of KOLs that have invested in it. So we know that we're going to be able to make a lot of noise. You know, we're not going to do a stealth launch and slip it out. We're really proud of what we're doing. And yeah, the next week, just keep watching our Twitter and yeah, keep watching our socials. At MudoHub.com, yeah, just to keep that clean. And you know, just going back to what you said, we ran out of sleeves and we've got like 1,200 tests to send out just to our Telegram group, 1,200. So when you talk about the resistance from Web3 coming into these types of products, actually, that's a really interesting metric because you know what? Everyone cares about their health. You know, this whole thing about Web 2, Web 3, I mean, it's so strange. You know, you could write a letter with a pen and paper or you can send an email. You know, I just see Web 3 as the email now because it's so much more efficient and better. But the problem with Web 3, kind of everyone tries to put something in a specific box. And if it doesn't fit in that box, you're not correct. And, you know, there's all these kind of weird groupings that have gone together. You know, for us, we just see this as doing normal business, but using better technology to make it more efficient. So yeah, call to action, just follow us on Twitter. Really, it's probably the best call to action, or join our Telegram group because we're about to flood it with loads of really cool stuff, and it's going to be really exciting.
Well, stay tuned. I think this has been quite a ride. I'm glad
I loved it. Thank you so much.
Is breaking. And I agree with what you said. Let's grow the DeSci space together. I'm glad to hear that you guys are not into radical human enhancement, which means you and BiohackerDAO are not in competition. So
we wouldn't be in competition anyway. I mean, and if anything, you could use our research platform to actually see what the epigenetic effects of those tests are. But if you figure out how to grow my hair back, I'm in. Right, I'm in. Like, if you can figure that out, I'm in. The only place I grow hair is on my eyebrows now. So, cool.
Any closing thoughts from Oliver?
No, I really think we tapped into a lot of interesting stuff. I'm really glad to have you guys, you know, on the show today. And honestly, I'm personally, you know, watching what you guys do since the very beginning when you entered, you know, the Web3 and started growing. And once again, a huge congratulations on what you have built so far. Congratulations for closing the race. And thanks for the test that I got and that I'm still due to get. No, I'm joking. No, really appreciate your time, and thanks a lot once again. And to the viewers that are watching online and offline, please just subscribe, like the channel, and follow Mudo Hub, follow Data Lake, and follow BiohackerDAO, which brought us today this amazing show, Accelerated Bio Podcast.
With as many people as possible.
Thanks, guys.
All right, thanks, guys.
Thank you.